Welcome back to the Colander Medical Radio Show. I'm your host, Anne-Marie Cronin, here talking with Dr. Brian Colander, board certified in internal medicine and specialist in artery disease, with offices in Bingham Farms and downtown Detroit. Dr. Colander is here with us discussing his concierge practice and how to avoid heart attack and stroke, and how to begin the reversal of artery disease. Now, last segment we were talking to one of Dr. Colander's patients, Debbie, who was telling us about her experience. She had been a patient of Dr. Colander's for about 10 or more years. And during that time, after, about 5 years ago, Dr. Colander segued into a more private, personalized practice known as concierge medicine. Debbie stuck with him. And Debbie, pick up where we left off. What exactly happened to you that you want to tell us about 3 years ago? Tell us a little bit about how things changed in your life with your medical profile.
A little over 3 years ago, my mom passed away, and she was in her early 90s. I was extremely close to her. Well, she was dying a year before that. So the heartache, the stress, the anxiety of living that experience with her and losing her was very traumatic. And after she passed, maybe a month or two after, I called Dr. Colander and I said, something is not right with me. I don't know, my heart is just not the way it has been in the past, and I don't know what's wrong. He said, well, come in.
What were the symptoms, by the way? When you say your heart wasn't the same, what were your symptoms?
I felt like I was skipping a beat. I felt like I was having palpitations. I felt lightheaded at times too with it, and I was really concerned that, something wasn't right. So Dr. Colander said, come in, and I did. I made an appointment with him, and he checked me and he said, I want to send you in for a stress test. And I said, okay. So I went through a stress test, and there were some results that were questionable on the stress test at the time. So I went back to see him, and he said, I'm going to send you to a cardiologist, which I was relieved at that point because I wanted to see what a cardiologist would think. And so I did go to see a great cardiologist who I had gained a lot of respect for, and he sent me in for an exam at a prominent hospital in the area, and Dr. Colander can tell you.
What was the exam, Dr. Colander?
Well, Debbie underwent a CTA, which is a CT angiogram. That's a CAT scan of the heart where they give you some dye contrast dye and injection, and we look at the arteries. So this tells us if there's a blockage and if there's narrowing of the arteries, and it's a great way of getting that information. But as we've discussed on other episodes, and we'll discuss in a few minutes, there are significant issues with that type of test.
Well, let me ask you something. What is the difference between the CT angiogram and the calcium scoring test? Do you see calcium on this test, this angiogram?
If you order the CT calcium score with the angiogram,
so it should be done together.
Yes, I'm gonna argue that you shouldn't do the angiogram at all unless you're having significant symptoms. Then you may want to know.
What are significant symptoms?
Chest pain with exertion, shortness of breath with exertion, dizziness, cold sweats, nausea, mostly symptoms with exertion in someone who's a high-risk person. So Debbie is not really a high-risk person. She's got a phenomenal lipid profile, which again we're going to review as being a misnomer and one of those things that you just can't count on anymore. So she's not a high-risk person. She's very low risk, but there were some questionable findings on her stress test, and she was very concerned about the symptoms that she was having and the abnormality on the stress test. So we sent her to a great cardiologist to get an opinion on that, and mainly for reassurance. Mm-hmm. And the cardiologist recommended that we do this CT arteriogram.
Arteriogram, okay,
And
then Debbie, what'd they tell you?
Well, I met with him to gain the results, and he said to me, he was scoring it, and he looked at me and he showed me the score at the time, and he said, you have a heart of a 30-year-old. And at the time, I was in my late 50s, and I was like, this is fantastic. Oh my God. I felt like I had a resurgence in life. Right. I had a resurgence. I have a heart of a 30-year-old. He said, your arteries are clean, just clean as a whistle. You will never, ever have to go on cholesterol medicine. You are so squeaky clean. And I'm like, that's fantastic. Heart doesn't run in my family. I have a heart of a 30-year-old. I'm clean, no cholesterol medicine. This is fantastic. I mean, I was really, really felt elated at the time. And then over time, when I would see Dr. Collender for my checkups and different things, he would do blood work. And he was saying, you know, Debbie, I'm questioning, you have inflammation in your arteries. And I said, I was questioning why he was saying this to me, because that's not what I was told 3 years ago. I was told this would never happen. I had squeaky clean arteries. So he said, you have inflammation, which means there's plaque in there, and it's the type of plaque that's not good. It's a type of plaque that, I'm not saying something could happen to you today, but it's something that could possibly happen in terms of stroke, heart attack down the road, and we need to address it. And so Dr. Collender, it took him a little while, because I was still in that mindset. I was completely healthy with this. He convinced me over time that I needed to have another test done, and he recommended that I have an ultrasound of my arteries in my neck. And so I went in, I had the test done recently, and the results came back, and I just met with Dr. Collender, and lo and behold, he was right. There is inflammation. I have a lot of plaque. I'm at a high risk level.
Wow.
And it was just shocking to me. So then we talked about the protocol, which was taking an aspirin a day, getting on cholesterol medicine, and changing lifestyle, because Dr. Collender is very, very specific about lifestyle changes, you know, plant-based eating, exercising, you know, really these kinds of things that are healthy living, which will help to ward off this kind of a situation and
Debbie, let me
just
just interrupt you here before we get lost on a subject. I wanted to ask Dr. Collender, when she came back from the cardiologist, came back from the first test, what were the blood tests you were doing to find this inflammation?
Well, I also want to go back and say this is 3 years ago,
right.
And my practice and my knowledge base has expanded a lot in that time. So the testing that we do has expanded, and over time, I'm learning that, you know, we did more testing that identified. So we're looking at different markers that measure vascular inflammation at different levels. So different people will have different markers elevated, and the same person can have different markers elevated over time depending on what's going on with their artery. So as we've talked before, and I'm going to review this again, blockages do not cause heart attacks and strokes. Blood clots cause heart attacks and strokes. Blood clots are caused by ruptured plaque inside the lining of your artery. And this plaque that ruptures is 85% of the time subclinical. So subclinical means it's not going to show up on a CT arteriogram. It's not going to show up on a carotid Doppler. It may not show up on your heart catheterization.
What about the calcium scoring test? Show up on that?
It would if you are forming hard plaque. So not everybody makes hard plaque. 20% of the people who have significant heart disease, coronary vascular disease, have soft plaque only, and it won't show up. And that's why you have to do both tests. You need to do a CT calcium score to identify the people who make hard plaque. And then we also need to do this carotid intima media thickness test, or for short, it's called CIMT ultrasound, to look at the wall of your artery to identify the soft plaque.
Now where did she get that test done?
It's really only done in our office because insurance companies do not cover this basic preventive test. You need to come to my office to do it. And I don't want to give the audience out there, our listeners, something to do that they can't access. So I want to make sure that if you're listening and you want to do a CIMT test, call my office now. Call 248-737-0091. My staff's picking up, and we will make sure that we can get you the CIMT test, and I'll be able to review it with you.
So in her case, this was an essential test.
Yes.
I want all my patients getting this test.
Okay, well, we're going to have to take a quick break. In the meantime, you're listening to the Collender Medical Radio Show. You can reach Dr. Brian Collender by calling 248-737-0091. Again, that number is 248-737-0091. You're listening to the Collender Medical Radio Show on News Talk 760 WJR.